Cancer is abnormal growth. It's where cells have lost the normal control mechanisms of life and death of a cell. Now, the cervix is what is also known as the mouth of the womb. It's a little tubular structure, and it sits at the top of the vagina. It's covered by a layer of skin, and in the inside it secretes mucus. Now, cancer of the cervix is an abnormal growth of that structure. It gets put against the cervix like this and gets turned around like that. What we understand about cervical cancer is that it is caused by a viral infection. In fact, about 15 to 20% of all cancers from different parts of the body are known to have a strong viral association, a virus being like a flu virus. And that's one type of virus. HIV is another type of virus. The virus associated with cervical cancer is known as the human papilloma virus. HPV is transmitted by skin-to-skin contact. So wherever there's skin-to-skin contact, that risk exists. Now, if you're using a condom, and it's covered the shaft, there will be prevention of transmission from the shaft to the vagina because that area is covered by the condom. But the areas that are not covered by the condom, such as the scrotum, which may have contact with the vulva or the outside area or with the anus, will be skin-to-skin contact, and therefore the virus can be still transmitted. Women who are HIV positive, as well as men in fact, are at greater risk of developing the cancer manifestations of human papilloma virus infection. And that is because HIV suppresses the immune system, as we all know. And that repression of the immune system makes HPV infection more likely to be persistent and therefore more likely to set off this cancer path, which starts with the precancer. It's the same. HIV positive women, their disease process is the same. Persistent infection with HPV, develop precancerous lesions, over time develop into cancer. Okay? The traditional method of preventing cervical cancer, which is 50 years old, is the pap smear. And what that means is that you pass something into the vagina, you visualize the cervix, which sits at the top of the vagina, take a little wooden spatula, we scrape the cells off, it's painless, we put it on a slide, we spray it to fix it, and then we send it to the lab. And at the lab, they stain it, and then they look under a microscope, and they look at the individual cells. And by looking at the cells, they can decide if it's normal or not normal. If that is abnormal, they get referred to someone like me, who is a specialist and a cancer specialist, and we do something called a colposcopy, which is where we actually look down. It looks like a binocular. Binoculars on a stand. We illuminate and magnify the cervix. We wash it with vinegar because vinegar changes these precancerous lesions and makes them white. And then we study them and we decide, does this patient have a precancerous lesion or not? If she does, we then excise it. We remove it. We do a simple under local anesthetic in the clinic. Very quick, no big deal. Removing those precancerous changes prevents her from developing cancer in the future. So it's a entirely preventative intervention. You okay?
I'm okay.
When you think that cervical cancer is a preventable disease with very simple interventions, it becomes an outrage that women are still dying from this disease.
Igama lami noma kaMhobo. Ngokwempangelo ndiphangela observatory. Ndiphangela la uDr. Robinson. Ndihlala eKhayelitsha. Ndiqale ungaphili ngo-2001. Ngo-April. Ekupheleni ka-April. Ndaziva uba ndinesinqe. Apha ngaphambili kukho ii-pains, but zingekho bad as pains. Wahamba uMay. Kwalile ekupheleni kwaMay ndaqalisa ubleeda. Ndableeda and ndibleeda kakhulu.
The symptoms of cervical cancer are abnormal bleeding, bleeding in an irregular fashion, bleeding after sex, bleeding after the menopause, after you've had your change of life, or a change in your regular monthly cycle becoming to an irregular cycle.
wandibuza umuntu endimsebenzela into yobana yintoni ingxaki yam ngoba wandibona apha ebusweni uba andikho rayithi. Ndamxela uba ndiyabhlida, andiyeki oko ndibhlida. Ngoko ke nangoko wathi uzawundenzela i-appointment eGrooteskill ngoJuni. Saya ke ndabe ndifikile eGrooteskill ndadityaniswa nogqirha ndenziwa i-pap smear. Zaphuma ii-results kwathiwa ndine-growth.
If you have cervical cancer, treatment options in early stages, when it's confined to the cervix, we can do what we call a radical hysterectomy. We can actually cut it out with very good outcomes. In a true stage 1, what we call a stage 1 early stage disease, it's confined to the cervix, there's what we call a 90% 5-year survival rate. In other words, 90% of women who get that cancer will be alive in 5 years' time. In other words, instead of associating cancer with death, you associate cancer with life.
The treatment yam ayalinda la July, sorry. Ndayiqala before July, bandenza i-radiotherapy.
In the more advanced stages, when it's grown outside of the cervix into the pelvis, into other parts, you can't do surgery. Those patients we treat with chemotherapy and radiation therapy. And it depends on how advanced it is. The success rate ranges from 70 to 30% will be alive in 5 years' time. So the more advanced the disease, and about 80% of the patients we see at my gynecological cancer clinic have advanced disease. So your cure rates go right down.
Ndingana kubaxelela abantu and ndikhe ndithethe ngaloo nto, like ii-friends zam. Ndiye nditsho kuzo ndithi hamba nokwenza i-pap smear. Sometimes omnye athi woyika elacephe. Ndimxebe elacephe liyavuleka, but xa lifika phaa ngaphakathi liyavaleka.
Why do women come so late? It's a mixture of not interpreting their symptoms correctly. It's a mixture of poor access to healthcare. It's a mixture of poor quality healthcare. And then all the stigmatization and taboo, because cervical cancer involves the women's genitalia. It becomes, like HIV, it becomes stigmatized. And what we really need is for society to grow up and stop stigmatizing the genital tract.
The checkup is finished. You can get dressed.
Ndingabacebisa abantu uba mabaye eziklinikhi. Umuntu angathi hayi ndiphilile akho nto nayo. Makaye ekliniki umuntu ayokwenza i-pap smear. Kuthathwe laa ncindi itshekwe. Ngoba ungathi uphilile kanti yona iyakusebenza phaa ngaphakathi.